Hello, I'm John Lynn, the founder of Healthcare Scene Blog Network, and this is the Xerox's Ask the Experts. Looking ahead after TEDMED, we have Markus Fromherz, the Chief Innovation Officer at Xerox Healthcare, is joining us today. Welcome, Markus.
Hi, John. Good to be here. Welcome to the participants. Yeah, so today we want to discuss TEDMED, address some of the key topics at the conference, and we also want to highlight some of the many diverse talks we heard.
Excellent, thanks. And we also have two other experts joining us today. First, we have Benjamin Miller, the assistant professor at the University of Colorado, Denver School of Medicine. Hey, Ben.
Hey, John. Thanks for letting me participate today.
You're more than welcome. All right, and we also have Nick Dawson here. He's the Chief Experience Officer at Frontier Health Consulting. Thanks for being here, Nick.
Hey, John. Good afternoon. It's exciting.
Thanks. So last week, actually, I guess 2 weeks ago now, was an exciting time for the healthcare industry. TEDMED was going on in Washington, D.C. So we'd like to take this time to kind of discuss the most talked about trends from TEDMED and forecast what's ahead in the healthcare industry. Markus, you want to lead us off?
Yeah, so for one topic, there was a lot of discussion surrounding data, big data, small data, donated data. So John, let me ask with this question perhaps. What do you want attendees to remember or walk away with when it comes to the future promise that data holds? And what is it that we can do today to make data work for the entire healthcare ecosystem?
Sure. So I'd say that the biggest thing when thinking about data is to realize that we're really at the very beginning of what's possible with big data. We've really just begun to use big data to improve healthcare. In fact, so much more can be done and will be done in the future. However, if we really want to get the most out of big data, we have to make sure that the data is, one, protected, but also is liquid. We need to ensure that the privacy of the data is there, otherwise people won't feel comfortable with us sharing it. But also, once we've ensured the privacy of the data, we have to make sure that the data is liquid, that it's available to whoever needs it whenever they need it.
I couldn't agree more, John. I mean, the opportunity for us to learn from big data is pretty amazing. However, I think we need to be a little bit cautious in our optimism because data out there is only good, data coming out is only good as data going in. For example, most of our EHRs have been built around maximizing revenue rather than actually enhancing patient care. So if we're going to begin to pay more attention to things like the triple aim, the healthcare policy of the land, we really must start to ask ourselves, what kind of data are we collecting, and will this inform our larger efforts around healthcare and health policy? I argue that if we actually have a ways to go for that, to truly have the right kind of data to see the full vision of big data. Yeah, there's promise, no doubt, but what if that promise is based on a reality that we're simply not ready for? During TEDMED, one of the things that came up quite frequently was data. It was described in ways that got people really excited, which is a hard thing to do oftentimes with data. Whether it was about liberating your data and allowing it to be accessed by you, the patient, or it was using dancers to show how cells interact and using this more subjective medium as a level of data to inform our research questions. The promise of data was everywhere. So if we use the data that we have to inform and improve healthcare, but those data are based on the current broken and fragmented system, the system that we have and not the system that we want, one may assume that the conclusion may be only supportive of what we have. That being said, there's still some valid reasons to use data now if we recognize the limitations.
Very interesting. Yeah, there was a lot of talk about big data, as we said, but actually a lot of talk about small data too. It's all that data that's already available about each of us individually that can be used to offer analytical insights to get started on, for example, care management programs. There were also a number of calls to not only give patients access to their data, but also let patients donate their data for research. So for example, one talk I really liked was by Amy Abernathy from the Duke Clinical Research Center. She talked about the potential of data donation. For example, for clinical research, she talked about a national data donation infrastructure, similar to our blood donation infrastructure and what impact that could have. Another interesting presentation was by Isaac Cohen from the Center for Biomedical Informatics at Harvard Medical School. He discussed the I2, B2, and SMART platforms. Both are used to study medical questions from available EMR data. He too emphasized that we need to make our data work for us. So, John, let me talk to you about another point. You recently wrote about multidisciplinary collaboration to achieve innovation in your TEDMED posts. How important is that? And what healthcare innovation idea or topic were you most impressed by that took a kind of multidisciplinary approach?
Yeah, so I'd say, one of the keys to innovation is really taking a look at the problem from a new perspective. In fact, that's what makes multidisciplinary collaboration so beautiful. Your collaborators have no preconceived biases in the way that they look at the problem or the situation. In fact, the most striking collaboration for me at TEDMED was David Ode and Black Label movement, which Ben talked about before, that looked at cells. It was a creative way to discover new ways that cells behave. Plus, it was really stunning to see how the collaboration also benefited the dancers in what was a unique, raw, and really beautiful performance, so that the benefit went to both sides of the equation.
Absolutely, John. And I think that this marriage of science and art is also seen in our attempts to create more team-based healthcare system. I mean, we know from data what some of the key components are of team-based care. However, as with most things, implementing these recommendations often play out differently in our practices. The art sets in, the implementation of the science sets in, and we see dancers. We see a symphony. We see the 12 people playing the same piano at TEDMED, or the tap dancing brothers who mirror each other, but then break out on their own. We're different in our roles and our responsibilities, and we have the chance to collaborate, but the question is, do we? How do we marry our respective expertise to better the health of a patient, of a community, of a nation? The future of healthcare is found in teams, no doubt, and at the center of that team is the patient. But surrounding that team are all kinds of other healthcare professionals, mental health providers, pharmacists, medical providers, dentists, others. We're different, and we work together in collaboration for the patient. We are effective and we are efficient. Our good friend Zubin Damania, or ZDog MD, described a new primary care clinic in which he's working, where he's basically building around the patient, where literally the patient walks down the middle of the practice, and surrounding the patient are all the members of the team. And they're available when the patient needs them. They're there for each other to collaborate. They are a team. They are all there and they are all available. Each has their own instrument ready when the conductor calls on them to play. In healthcare, marrying science and art is seen every day.
It's interesting. I'll jump in there, Ben and guys. My big takeaway from this, and kind of the aha, is that this is done in other industries pretty commonly. We talk a lot about healthcare as being a silo, and this is one instance where I think that's very much the case. If you look at things ranging from consumer electronics to the travel industry to just about anything that touches a wide range of folks, they have practiced this for years, and they do it in an interesting way. And so you look at a car manufacturer, for instance, and they couple designers, real product designers, with engineers, with people who understand aesthetics, but also electronics and computer systems and the fuel economy. And that's a pretty wide-ranging team. And then they do something that we're really just getting increasingly comfortable with, but still nascent in healthcare, and that's the idea of involving patients and the actual end user of our process and our solutions in their design and development. And so when I listen to talks like Zubin Damania, ZDog, and I listen to even some of the educational things that are coming out of med schools and Dr. Abernathy's talk, what I hear there is a very positive trend, but something that I would argue is we're just really late on, which is the idea of including patients in that multidisciplinary collaboration approach. And in fact, if there's a theme for me, it's the idea that 2013, and TEDMED certainly demonstrated this, is the year of the e-patient.
Yeah, and one more point on collaboration. So in addition to collaboration around the patient and for the patient, there's of course a topic that hasn't been talked about as much in the past, which is collaboration with the patient. And we'll talk about this in a minute a bit more. But for something a bit different, I wanted to mention Jessica Richmond's very compelling presentation on citizen science. Jessica is the founder and CEO of uBiome, where you can have your microbiome sequenced. And her vision of citizen science is one that allows professional scientists and amateurs to collaborate on large-scale research questions. I really recommend checking that one out. So let's talk a bit more about patients. John, how can the healthcare industry empower patients to become even more proactive in the management of their health? And do you think that role of the patient will evolve?
So when I start to think about patients, I really think the key to an active patient is providing the data that motivates change. This includes collecting the data, which I think we're starting to see today, but it also includes processing the data and then displaying the data to the patient. When you combine this data, both the processing and the display of the data, but also with positive social pressures, we'll have a really proactive group of patients that are interested in improving their health.
So I'll put my slightly contrarian hat on today, and this is kind of in the spirit of multidisciplinary collaboration, right? And, maybe challenge the notion a little bit that the industry needs to help engage and activate patients, and suggest that maybe it's in reverse, and that maybe the patients have been activated for years and are looking for an industry that supports them in the way they want to interact with it. And in a maybe even existential example of that, when we heard Peter Attia, I hope I'm pronouncing his name correctly, who's a physician, speak about his research, there was even a moment there where I think he said, the more I understand about the science, the more my hypothesis changes, the more I understand that the way I have approached patients for years may in fact be flawed, and I need to rethink that dynamic a little bit. So I think we're beginning to see that, and you know, maybe the true answer is that it's a comfortable medium somewhere, and that as we exchange data and share more data in both directions, that it's a coming together and not one activating or engaging the other, but kind of a mutual meeting of minds.
So on this topic of the patient at the center of healthcare evolution, maybe let's reflect some more on specific presentations. So for example, one person I found really both passionate and compelling on that topic right on the first day was America Bradshaw. She's down in Southern California. She talked about making community members participants in healthcare. And her Latino Health Access Center, uses a participatory approach to community health education, where they have programs that train community health workers as leaders of wellness and change in their communities. While I'm speaking, another very interesting talk was by Susan Desmond-Hellman, Chancellor of UC San Francisco. She discussed the need for giving patients a seat at the table, for example, for clinical trials, and to enable patient data sharing at scale. She also addressed specific requirements for success. So for example, don't underestimate the patient, enable the environment, prepare for messiness, provide incentives, and tap into the social connections. So John, any presenter that stuck out in your mind?
Yeah, so I'll just mention a couple, which is really hard because they all had interesting messages, but Jonathan Bush and Zubin Damania, ZDogg MD, were probably two of my favorites because they weren't shy about discussing the real challenges facing healthcare. Sometimes we get a little bit of a reverberation chamber where we just talk to each other and we're afraid to really tell the truth, and they weren't afraid. But also Deborah Estrin's discussion of packaging up your small data. I think it's just a really powerful concept to just package the small data and make it useful.
Those were great talks. So finally, let's look ahead a bit into the future, and let's try to get everybody's insights on this. What do you predict the hot topics will be of TEDMED 2018 and 2023, so 5 and 10 years from now?
Yeah, so I'll start. I think 5 and 10 years is the right way to look because it takes time for change. But I'll offer 3: genomic medicine, the medical tricorder, and finally, I think we're still going to be battling patient privacy.
And I'm not very patient, and I would prefer not to wait till 2018. But I'll have to say that my kind of vision is that we create a nation of fragmentation fighters in healthcare, folks that just simply don't want to tolerate the ridiculous fragmentation that we've seen. And then I also think the role of personalized medicine will probably be pretty important.
So I'll preface this by really applauding the folks at TEDMED for what they did with the great challenges and integrating patient voices also on the main stage, but as well as in some of the participatory programs. And I think we'll look back in 20 years. I first want to say, I don't want to wait for the tricorder. If this idea can come to reality, I really like the tricorder. But I think we'll look back and have a little bit of a social phenomenon where we say, I can't believe that we had so many of these discussions about entire groups of people without having them more equally represented. And I think we'll see a big patient population. That'll be that participatory medicine thing.
It sounds like we agree that technology will have a tremendous impact on how medicine will be delivered, but some of the same issues will remain on how much we know and how we learn about our own health and the impact on our daily decisions.
That was a great discussion. We're unfortunately at the end of our time, so now I think it's time we put some of this thinking from TEDMED into action. So thanks everyone for participating, and a special thank you to all our viewers as well. For more information, you can follow Xerox Healthcare at Xerox Healthcare on Twitter, and myself, I'm @TechGuy on Twitter, or visit www.xerox.com. Any final thoughts, Markus?
Well, thank you all for joining us. This is Xerox Ask the Experts.